This is an embryo from a hen. This embryo is made from the ovum from the hen and the sperm from the rooster. When the ovum and the sperm come together, they make an embryo. The embryo fertilizes, it grows in the egg several at a time, and then it incubates and then is hatched, and then you have your life. The humans, an embryo formation in a human comes from the same thing, an ovum from a female, sperm from a male, but usually you don't launch several at the same time, you launch one every month. The ovum from the female comes from the ovaries. There's two ovaries on each side of the female. They sit down in the pelvis and they straddle the uterus. The ovary, from productive age of sometimes 16, now it's getting earlier because of exposure to plastics and other things in the environment, but usually at 16, 15 to 16, you'll start to have your periods, and they'll go until you're about 40 to 50. But usually the standard period is one ovary on one side will develop a cyst. That cyst is an ovum, and when the time is right, that's in the middle of the month, 2 weeks before your period, it'll launch the cyst out. That rupture of that, let's just call it an ovum, the rupture of the ovum out to start its journey to hopefully become fertilized results in a little bit of pain. Usually it's pelvic pain on one side or another, depending on which ovary is launching the ovum for that month. Again, it's alternating months, right? So hopefully one ovum gets launched, you have a baby, and then you're good. The problem in polycystic ovarian syndrome is that the feedback loop between the brain telling the ovaries to launch an egg, wait a month, launch an egg, wait a month, launch an egg, the feedback loop is off for some reason. They're thinking genetics, scientists are still unsure about why this happens, but in a polycystic ovarian syndrome patient, instead of one little cyst forming once a month, you have multiple cysts forming all at the same time whenever they want. The feedback loop as you get older gets worse. So this is one of the biggest problems, is instead of a nice gentle ovum being produced from one ovary, a little bit of inflammation and swelling, you'll have multiple cysts all produced at the same time and nothing will launch. There's an overproduction of androgen. That's the dominant male hormone, testosterone. When there's overproduction of that hormone, you'll have a worsening of the feedback loop between the talk, I guess you can call it, between the brain and the ovaries. And you'll have all these cysts ready to go. These ovums, I guess, can be considered ready to go, but nothing launches because the feedback loop is off. So they continue to grow. Now, you talk to any woman with polycystic ovarian syndrome, you'll know that there's back pain, there's belly pain, there's belly enlargement, there's irritation, because all these cysts are painful. It starts an inflammatory reaction. Any gland that's growing out of control causes an inflammatory reaction. So there's pain associated with it. There's infertility associated with PCOS because you don't launch any ovum. You can't get pregnant. At least most women can't. Now, polycystic ovarian syndrome, there's a very small subset of women who don't have any cysts like this, but it's a syndrome, so there's accumulation of different symptoms to make this diagnosis. So the hallmark of PCOS is to get an ultrasound of the ovaries and you'll see multiple cysts. Bingo. And you usually need further workup in the form of blood tests for the other two problems that I'll mention in a second, but that'll be the first diagnosis. Because of all that testosterone being secreted and the poor feedback loop between the brain and the ovaries, you'll have a second problem that I'll mention, which is commonly seen in PCOS. Because of all the testosterone that's not supposed to be that high in women, you'll have facial hair and acne, typical in men. Now when that happens, it's called hirsutism. That's one of the giveaways. When you have somebody comes in with irregular periods, excessive weight gain, difficulty in losing weight, and then facial hair, again, usually the diagnosis is moved over to PCOS. A good doctor will still have to work up other possibilities, Cushing's syndrome, adrenal hyperplasia, other things like that. But that's where the typical workup starts, and then a referral to an endocrinologist. There's a great endocrinologist, Dr. David Erdman, downtown Chicago, University of Chicago, who runs a PCOS clinic. That's where I usually will send most of my patients. But again, the workup starts in primary care. So a lot of patients don't even know. They just think they're infertile, they're overweight, they have facial hair, I'm going to deal with it. They don't even see anybody. Just get their pap smears and that's it. But it's a shame because there is a way to take care of these symptoms that are a result of PCOS. Science hasn't found a great treatment for it. We just take care of the causes. But I do think that there's a way to reverse any disease, and that's with exercise, nutrition, and mind-body medicine. This is a yoga banner behind me. I think there's great things that can be established or attained when you go outside Western medicine and you consider Ayurveda, traditional Chinese medicine and acupuncture, nutrition changes, but we'll just save that for another lecture. The idea is that when you have the PCOS diagnosis, you have to make changes. There are prescription medicines that work fantastic. We have medicines that will cut down the amount of androgen hormone and it cuts the facial hair. Also have creams that will cut down the facial hair. We have medicines that will turn off the bad talk or the misguided talk between the brain and the ovaries and stop the production. The final thing, which usually happens, is there's an oversecretion in PCOS patients of insulin. And it doesn't just start suddenly. It slowly develops over the course, just like the cysts and the high testosterone. So one of the other tests to get is a fasting insulin level and a glucose level. If you are PCOS sufferer and you have a very high insulin level, well, guess what? The cells don't like consistent or persistent elevated insulins. It's dangerous because insulin is usually secreted after a big meal, and it makes the carbohydrates that are extracted from your meal, it makes them go straight into fat cells to store for later. So if you have an oversecretion of insulin, then you'll always have carbohydrates and the byproducts of your food go into the fat cells, so you get fatter and fatter and fatter. Especially with centripetal obesity, you'll have fat being stored in the abdomen, and that's not good because too much fat, it's called visceral fat, too much visceral fat will actually act as an organ and secrete excessive amounts of estrogen. So there's your other problem, and the excessive amounts of estrogen will throw another wrench into this bad misinterpreted information from between the brain and the ovaries. So with the problem of oversecretion of insulin, you'll develop insulin-resistant problems with diabetes. Usually that's termed diabetes type 2. They used to call it adult onset, but now with all the kids getting obese and having type 2, they had to change the name to insulin or diabetes type 2. So when that happens, the cells, which usually respond to insulin, they don't respond to insulin anymore. They ignore insulin signals. The anecdote is when you have a kid that's a teenager that's making a lot of noise with a band and his friends come over and make more noise. What does the parent do? The parent ignores the sound that comes from the garage. Or the parent puts in earplugs so that the parent can sleep regardless of the amount of noise that's coming. So I think of the cell that's being exposed to a lot of insulin as the parent. The cell puts the earplugs in to shield itself from all the excessive noise coming from the hypersecretion of insulin, the oversecretion of insulin. And that's dangerous because what happens is that you won't be able to digest carbohydrates properly, and you'll have every carbohydrate stuffed into the fat cell, and as I explained before, you'll have increasing obesity. There's something called centripetal obesity. It's when you keep all the fat towards the center, then actually the body starts to digest itself. It starts to digest muscle because it can't utilize fat or carbohydrates anymore. That's typical in Cushing's syndrome, and that's one of the diseases that has to be ruled out when you have polycystic ovarian syndrome. I'm not going to talk too much in detail about that, but if you go to University of Chicago's Polycystic Ovarian Syndrome Clinic, David Ehrman has done a good job with giving some patient information. I'll see if I can put a link here to that clinic. And you can empower yourself with what usually happens in the dynamics of polycystic ovarian syndrome. So usually polycystic ovarian syndrome patients respond well, like anybody else with diabetes type 2, to lower carbohydrate loads, to restrictive diets that take advantage of more healthy fats maybe a slightly higher protein or low glycemic index foods. I think that gluten-free is always helpful. I think dairy-free is always helpful as well. But bottom line is you have to try to take advantage of a mostly plant-based whole food diet. In addition, that'll keep the sugar from going and bouncing all over the place. That'll keep the weight down. That'll keep the excessive amounts of estrogen from fat cells to be secreted. Number two would be exercise. Usually exercise also helps because of the hormones that are released during exercise. Exercise also helps to control weight. It also helps to give you a better sense of well-being, so you're not a prisoner of the diagnosis. And it also helps to stabilize the stress response. This is what this banner is. This is an Ayurvedic banner. I think yoga and traditional Chinese medicine are great forays of medicine to investigate, and once you've been given a diagnosis. I think the mind-body medicine is important for keeping the nutrition plan, keeping up with all the stress you're going through and the disease manifestations, keeping up a nice relaxation response and not getting too stressed out, because that also will release a lot of hormones in this cascade of inflammation that leads to other things down the line. So relaxation therapy, mind-body medicine, developing the relaxation response, yoga or exercise, very important. The final thing, in addition to nutrition and thinking, is the formation of some bond with a doctor or primary care doctor who can coordinate all the workup. Many times people just get lost because they get their pap smears, they're told, oh, you just have to lose weight, or we'll give you a pill for the facial hair, and then that's it. I really think that you have to be ruled out, and unfortunately it's difficult for most specialty services, even the primary care guys. It's difficult because most patients, 1 in 3 Americans, is obese already. So they'll come in with obesity, they'll have a little bit of diabetes, a little bit of facial hair, and we'll say that's all the workup you need. When actually polycystic ovarian syndrome needs further workup. I mentioned all the tests before, and it would be empowering to know you have this thing and you can tackle it, and there's ways, whether it's Western medicine or alternative medicine, there's ways to lead a healthy lifestyle. And Western medicine said there's no cure for polycystic ovarian syndrome, but I do think that with alternative medicine, that's either Ayurveda or traditional Chinese medicine, they don't have a definition for those things. We just say the patient can get better and back to wholeness. So it will always help to have a focus of where to go, but you need somebody to be your advocate for the proper direction. And finally, with polycystic ovarian syndrome, in addition to having a good doctor that will follow you, it's important to control the disease process and know when it's time to use medicines. There's a lot of different supplements that help with controlling the overproduction of testosterone, the obesity, and some of the other inflammation. Nutrition or supplements are very important. But when the disease is manifesting or interrupting life too much, it's time to go for prescription medicines or surgeries. So you have to know or have an advocate that will work with you to figure out this is getting too bad, or we still have a lot of time and we can do conservative treatment.